Hello, everybody. My name is Karen Pryor-Topalis, and I am, like you, a provider. I work at the Mount Sinai Rehab Hospital in Hartford, Connecticut, where I do quality, admissions, and case management. And if you could just indulge me for one quick minute, could I see a show of hands of the nurses in the room? Okay, and if everybody could give them a quick round of applause for National Nurses Week. Shout out to all the nurses and the wonderful work that y'all do. I'm very proud to be a part of the nursing community. Made that decision many, many years ago, and hopefully you all agree with me. I've never regretted that decision. I love what I do, and I'm sure you guys feel the same way or you wouldn't be here. So thank you for all that you do. I got the exciting job today of reviewing with you a case study, and I thought it was real interesting when they asked me to do this because, as I mentioned, I work at Mount Sinai Rehab Hospital in Hartford, and we are a freestanding rehab hospital, an IRF, and attached to our building is a former medical surgical hospital that actually has inpatient psychiatric services, wound care, and we lease space to an LTCHI. So we actually have an LTCHI attached to the rehab hospital. There's separate companies. We don't work together in a sense that we're not owned or operated by the same group, but we are very fortunate to have that resource there, and we oftentimes will collaborate on things. So when they suggested a combined case study and that I would have the opportunity to be the person who facilitates that, I really jumped on that. So thank you. As with all the presentations, it's always important to go through some of the acronyms in the presentation. None of these are going to be new to you, I don't think, but every now and then something pops up that looks a little different, so we want to make sure that you're aware. I'm not going to read through them, though. So the objective of today's case study is to apply the knowledge that you've acquired over the last several hours from Carol and Ann this morning, and for the LTCH folks for some of the training that you received yesterday, to apply it in a case study situation. And what we're going to do is we're going to take the materials that you have in your packet. You should have sort of the case study. It says IRF and LTCH case study, and also there is a coding sheet in there for you as well. So what we're going to do is we're going to introduce to you Mrs. S., and this was a case study that we put together for the purpose of really being able to have you practice some of the skills that you've been taught over the last day and a quarter. And Mrs. S. is a 78-year-old female. She was admitted to an acute care hospital with respiratory distress and right hip pain following a fall. Upon admission to the hospital, she was noted to have respiratory failure, a right proximal femoral fracture, and a deep tissue injury on her right lateral malleolus. Now, am I the only one in here who loves this photo? But I love this photo of Mrs. S. I imagine her waiting for her ride to go to church. Whoops, going backwards. Okay, so after 3 weeks of acute care hospitalization, the good news is that Mrs. S's clinical situation improves. She's off the ventilator, her tracheostomy is now plugged, and luckily she's saturating on O2 at 2 liters and doing quite well. Mrs. S is transferred to a post-acute care on December 1st for both respiratory and physical therapy rehab. So what we're going to ask you to do is we're going to ask you to work in groups at your table. We're going to use the documents that you have in your folder here and the coding sheets, and we're going to take about 25 to 30 minutes for you guys to do that in your tables. We are having you assess just a certain number, not the full instrument that you're required to do back at your facilities, but really just to highlight the items that we've been focusing on in the last day and a quarter. So we'll do GG0130, a subset of the self-care. We're going to do GG170, which is mobility, or a subset of those. The M0210, the M0300. We're going to review those drug regimen ones that Carol showed us this morning. N2001, N2003, medication follow-up. And then we're going to look at some of the discharge items as well. GG0130, GG170, the M210, the M0300, and the N2005. We're going to ask that, again, that you work in your groups and use the documents that are in your folder and work together. My oldest daughter is a kindergarten teacher, and she gets stopped all the time. People ask what she does, and she says, I teach kindergarten. People say, oh, that's cute, you know, isn't that nice? And she likes to remind her father and I that there is a book that's written that says everything I really need to know I learned in kindergarten. So she reminds us that she is actually responsible for teaching people's lifelong lessons. So for a few minutes, I'm just going to channel her spirit and remind you all to work together, be inclusive in your groups. Some of you came by yourselves, and so we don't want anyone to feel left out. So use those principles you learned in kindergarten and include everyone in your group. We're going to meet back in about 25 minutes. Can anybody tell me what time it is? 11:10. So let's say 11:30-ish, we'll check in, see how you're doing, and then we'll probably convene back at about 11:35. Does that sound okay? Okay, everybody's all ready to work. A group of overachievers we have in the room. All right, so we'll see you in about 20-25 minutes. I want to make sure we have plenty of time to go over the correct answers, because that's key for you to bring back to your folks back at your facilities. So how about if we start reconvening? Does that sound okay? Okay, I got some affirmatives over here in the corner. I see some heads nodding. Thank you. I love the feedback. Lets me know that you're hearing me and that you understand what I'm saying, so I appreciate that. I don't do speaking very often. I'm, again, like you guys, I'm a provider, so a little out of my comfort zone, and appreciate any feedback you give that way, so thank you. Okay, so we're going to start with the admission assessments, and as I mentioned in the beginning, we're going to do just a subset of GG0130, the self-care, okay? So for the folks for the LTAC, I think this was new for you yesterday, is that right? Okay, and for those of us in the IRFs, this is not necessarily new items for us, so let's see how we do. So, for item GG130A, eating, we're looking for a code on the admission performance of our patient. The correct answer is 88, not attempted due to medical condition or safety concerns. The discharge goal was 06 independent. And let's look at the rationale for that. So 88, not attempted due to medical condition or safety concerns. Remember, Mrs. S was actually MPO when she came in. She was getting some tube feeds. So the actual act of eating, and I think Ann yesterday answered a question related to this for the LTAC folks. It's the actual performance of eating, not the nutrition piece that we're coding on this item. So it's 88, and the discharge goal is 06. So we're really hoping that she's going to be able to perform eating by the time she goes home. Oral hygiene, which is GG0130B. Admission performance, the correct code is 05, setup or cleanup assistance. And the discharge goal, again, is 06, independent. The rationale for that decision and that code is that Mrs. S brushes her teeth when a helper sets up her at the bedside table with her oral hygiene items and puts them away after she completes the activity. And we're hoping that at discharge she's going to be able to perform this at an independent level. Toileting hygiene, a rehab nurse's favorite item. The admission performance is 04, supervision or touching assistance. And the discharge goal is set at 06, independent. The rationale for that is that Mrs. S requires steadying assistance from one helper while she stands and adjusts her underwear and slacks. After she finishes voiding on the commode, She's able to wipe herself and adjust her underwear and slacks with contact guard from a helper. Does that seem right to you guys? Okay, good. I'm seeing some head nods. And again, the goal of independent at discharge. Okay, let's look at the GG items for mobility, GGO 170. So here the first one is GG 170F, the toilet transfer. Admission performance correctly coded should be. At 03, partial or moderate assistance. The discharge goal set by probably the occupational therapist was independent, 06. I'm loving the discharge goals because I also identify as a case manager, and I'm thinking this lady's going home from our facility, right? If she can do toilet transfers and toilet hygiene, we're 3/4 of the way there for getting this patient home. Okay, the walk 10 feet item for admission performance, GG 170I is, whoops, what did I do here? Oh, I'm sorry. So we're doing walk 10 feet. I'm using, some reason I'm not moving forward. Let me just try one more time. Oh, okay, well, let's just keep going. There we go, sorry. For some reason, I needed to click it twice, I apologize. So the walk 10 feet is 03, partial or moderate assistance is the correct score. The discharge goal, we're hoping, is 04, supervision or touching assistance. How about walk 50 feet with 2 turns? What did we decide the correct code was for admission performance? I'm not sure why I have to keep doing that. Okay. Not admitted due to medical condition or safety concerns. So it was not attempted due to medical condition or safety concerns. For discharge goal, it's supervision or touching assistance. And the rationale for that is, we coded 88 because it was not attempted due to medical condition or safety. It was not performed on admission due to the patient's fatigue and decreased endurance. We are hoping, though, that at discharge she'll be a supervision or touching assistance. And again, based on her prior mobility, comorbid status, and current functional performance, and motivation to improve, the physical therapist anticipates that she will be able to walk 50 feet contact guard, making 2 turns by discharge with a rollator walker. Walk 150 feet, the admission performance correctly coded for Mrs. S is 09, not applicable. I'm seeing some faces there. And we'll talk about the rationale for that, okay? And the discharge goal is not applicable, okay? We wanted to do the case study where we gave you some examples of things that you might not have thought of. So the rationale here is, the reason it is 09 not applicable is because the activity was not attempted during the 3-day assessment period, and most importantly, that Mrs. S was not walking 150 feet before she fractured her hip and before she got sick. At discharge, the discharge goal, again, would be 09 because we do not anticipate that she's going to be able to do something she wasn't able to do before she injured herself. There could be times where that could be different, but in this particular case and in this scenario, that's how it should be properly coded. Okay, now we're going to do a polling question. This is my first polling, so bear with me. So GG170Q1, does the patient use a wheelchair and or scooter? If you select A, that's no, and select B is yes. All right, you guys got to pull out your phones again, right? You had to put them away for a little while. So I'm just watching people. Looks like people are scoring, and of course, looks like we have a lot of really smart people in the room. And the correct answer is B, 1, yes. And the patient uses a manual wheelchair for self-propelling on the unit and during her therapy evaluation. Okay, so let's go back to the mobility subset, and we're looking at coding GG170R, wheel 50 feet with 2 turns. And of course, we're coding these because we just mentioned she uses a wheelchair. So the admission performance score for her is 2, substantial or maximal assistance. We've set a discharge goal of 06, independent. So we have high hopes for Mrs. S. I'm not sure why that keeps happening. I apologize. Does the patient use a wheelchair and/or scooter? We answered that yes, manual, right? I'm really sorry about this. I don't know why that's happening. I'm sure it's something I'm doing, so I apologize. GG170S, wheel 150 feet. The admission performance code should be substantial maximal assistance. Our discharge goal is set for 02, substantial maximal assistance. Wheeling 150 feet could be pretty tough for this lady. And the rationale for that is that after propelling herself about 20 feet, Mrs. S becomes fatigued and a helper had to propel her the remaining 130 feet distance to complete the activity. Her discharge goal, the physical therapist anticipates that beyond 70 feet, Mrs. S will need to be propelled by a helper for the remaining distance to do this activity. So we do anticipate that she's going to be able to improve in what she's doing, going from maybe 20 feet to 70 feet, which again, if I put my case management hat on, I'm pleased because household distance is usually somewhere in the middle there, so she might be able to do some of it on her own and be left for periods of time during the day. But we don't think she's going to be able to be independent with this activity. Okay, GG170SS1 indicate the type of wheelchair or scooter used. And the correct answer is manual. How did people feel about that? Some surprises? Yeah. But that's okay. That's what we're here for. That's why we give you these scenarios so that you can kind of think of all the different situations that you may encounter when you go back to your facilities. There are a lot of coding examples in the manual to use too, as well as use these for training. So the admission assessment for Section M, skin conditions. So Anne did a really great job going over those, but let's see when we put it in a scenario where we're doing it on a patient with a story, whether we can pull it all together as well. Okay, so this is a Slido question. Does the patient have one or more unhealed pressure ulcers or injuries? And again, we're talking about admission. This is item M0210. You select 0 is no, 1 is yes, or you could enter a dash. We wouldn't recommend that. All right, we got people coming in. You're such a smart group. It looks like most of you are saying yes. And let's see if you're correct. Of course you are. You are correct. There was an unhealed pressure ulcer. So the correct answer is 1, and the rationale is that upon admission to the PAC setting, Mrs. S did have a pressure ulcer on her coccyx, and she also had a DTI on her right lateral malleolus. So what we'll do here is we'll go through these items, and I'll slide in the correct code, and we'll see how you did, okay? So M0300A1, the number of stage 1 pressure ulcers. The admission assessment correct code should be a 0. For M0300B1, the number of stage 2 pressure ulcers, correct code should be a 0. Number of stage 3 pressure ulcers, which is item M300C1, the correct code is 0. And 300D1, the number of stage 4 pressure ulcers, correct code is a 1. M300E1, the number of unstageable pressure ulcers or injuries due to a non-removable dressing or device, the correct code is 0. The number of unstageable pressure ulcers due to slough or eschar, which is 300F1, 0. And M300G1, number of unstageable pressure ulcers or pressure injuries with deep tissue injury, should be coded a 1. Yeah, people are yelling it out. Good for you. That's great. So Ann did a great job. At first it seems a little, you got to kind of walk through it. I find for the skin ones, if I say it out loud, I don't know why, but if I hear my own voice asking me the question, it seems a little clearer to me. So the rationale here is upon admission to the PAC setting, Mrs. S had a pressure ulcer on her coccyx and a DTI on her right lateral malleolus. To accurately stage these wounds, the nurse reviews the history of these pressure ulcers in the patient's medical record. Although the coccyx pressure ulcer has evidence of improvement and decrease in size upon the PAC admission assessment, the acute care medical record classified it as a stage 4. Therefore, it should continue to be classified at that numerical stage until healed. The pressure ulcer on the right lateral malleolus is assessed as a DTI, and this is confirmed upon admission to in the patient's medical record, and the surgical site would be coded in M300 as it's not a pressure ulcer, right? It's a surgical wound. Okay, let's do section N. Carol taught us that this morning, so let's see if we can apply those principles now. Oh, we got a Slido first. All right, so for N 2001 on the admission assessment for Mrs. S, did a complete drug regimen review identify potentially clinically significant medication issues? If you believe the correct answer is A, or 0, no issues were found. Or B, 1, yes, issues were found during review. C, 9, it's not applicable, the patient is not taking any medications. Or D, enter a dash. Okay, we're doing good. We got a lot of responses in, so let's see what the correct answer is. You guys were saying yes, and of course it is yes. Very good. And the rationale is that the pharmacist did identify 2 different doses of the same medication to address mild pain, right? So the combined dosage would have exceeded the maximum amount of dosage for ibuprofen. And the pharmacist considered this a duplicate therapy as a clinically significant medication issue. And my husband's a pharmacist, and when we were doing this, I asked him, what is the most common thing you kind of see? And he brought this up. It seems like a minor thing because we're only talking Tylenol, but too much Tylenol can be a very bad thing for folks. So that was my husband's input. Okay, for the next Slido, N 2003 on the admission assessment, did the facility contact a physician or physician designee by midnight of the next calendar day and complete prescribed recommended actions in response to the identified potentially clinically significant medication issues? Wow. So A is 0, no, or B is 1, yes, or C, enter a dash. All right, people are scoring, coming in. Overwhelmingly, people are saying yes. And the correct answer is yes. And the rationale is that on that day of admission, the pharmacist identified a significant medication issue and contacted the admitting physician and left a message. 1 hour later, wow, that's some doctor, right? 1 hour later, the admitting physician returned the pharmacist's call to clarify and change the order. And that evening, the charge nurse noted and implemented that change. So that's great practice. Okay, we're going to move on to your discharge items. So you guys holding on with me here? It's a lot to go over. I appreciate it. Okay, so we're going to do discharge, and these are planned discharge items of subset GG0130, the self-care. Okay, for GG130A, eating. Remember, she was not able to perform that on admission. How is she doing at discharge? Wow. 06, independent. Yes, we met our goal too, right? And of course, she gets to eat again. That's the big prize. All right, so GG130B, which is oral hygiene. The discharge performance is, oops, I'm sorry. This is what I keep forgetting to do. I apologize. The rationale behind eating. So she is independent. Mrs. S self-feeds and drinks liquids without assistance. She also requires additional nutrition with supplemental tube feeds. She opens containers and uses utensils and a cup and a glass to self-feed and drink liquids without any assistance. The tube feed is not considered when coding the eating activity. Did that trip anybody up? No. A little bit. Some are saying, yeah, maybe. Okay. So it's the act of eating. All right. GG130B, oral hygiene, discharge performance is independent. That's great. Now I'm going to go to the rationale. And that is 06, Mrs. S completes all tasks, including the oral hygiene activity, without any type of assistance. So that's great. Toileting hygiene. GG130C, discharge performance, that's great. Independent, 06. Great job by the rehab nurse and the occupational therapist, probably. And the rationale is she manages her toilet hygiene without any type of assistance. Okay, the mobility items for planned discharge. GG170F, the toilet transfer. Discharge performance is, and should be properly coded as, independent. That's a key to going home. Mrs. S completes this activity without any type of assistance. Good for her. GG170I, the walk 10 feet, discharge performance correctly coded should be. 04, supervision or touching assistance. And the rationale for that is that Mrs. S does walk the 10 feet using a rollator walker with supervision from one helper. The use of the assistive device to complete an activity should not affect the coding of the activity. It's the helper that is what's providing the 04 score. Walk 50 feet with 2 turns, GG170J. Correctly coded is 04, supervision or touching assistance. And the rationale here is Mrs. S walks 50 feet with 2 turns using the rollator walker and contact guard assist. Again, the use of the assistive device to complete the activity should not affect the coding. It's the helper that affects the coding. And GG170K, walk 150 feet. Remember, this was one that you guys kind of were unsure of on admission. Let's see how you did at discharge. 09, not applicable. Do you remember the reason we gave for why it was 09 in the beginning? Because that was not an activity that she was doing prior to. Very good. Okay, does the patient use a wheelchair and/or scooter? GG0170Q3. A is 0, no. B is 1, yes. Okay, I think everybody knows the answer is yes. And the answer is yes. Very good. She uses a manual wheelchair. So wheel 50 feet with 2 turns. The discharge performance correct code should be 06, independent. So she might not be able to walk by herself, but she is able to get around in her wheelchair. So if her house is accessible, she may be able to go home. I'm always looking for the home discharge. Okay, and the rationale for that is Mrs. S wheels herself 60 feet and completes 2 turns without any type of assistance. Does the patient use a wheelchair and/or scooter? Kind of asked that. The answer is yes, she uses a manual wheelchair. GG170S, The correct code for 150 is O2, substantial or maximal assistance. Bless you. And the rationale for that is Mrs. S wheels herself 60 feet, which is great, which is nearly her prior level of function. A helper is needed to propel her wheelchair the remaining 150 feet, however. The helper does more than half of the activity to complete it. And item GG170SS1 indicate the type of wheelchair or scooter used, and she uses a manual. And there was a question that I think Ann answered yesterday that came up about why did we ask that twice, whether manual or scooter. And Ann pointed out that, sometimes for shorter distances, people use a manual wheelchair, but in further distances, they may use an electric when they go out to the community. So just to remind people, that's why we asked that question twice. Okay, Planned Discharge Assessment, Section M, Skin Conditions. Does the patient have one or more unhealed pressure ulcers or injuries? This is item M0210. A is 0, no, B is 1, yes, and C is enter a dash. I feel like that's a trick at the end there. Nobody picks C. Okay, the answers are coming in. The correct code is 1, yes. And that's because at discharge, Mrs. S has one unstageable pressure ulcer on her right lateral malleolus. Okay, we're going to remind you of the correct codes that were in there from admission, and we're going to slip in the discharge codes, okay, so you have them. Number of stage 1 pressure ulcer or pressure injuries, the discharge assessment should read a code of 0. The number of stage 2 pressure ulcers, discharge assessment, code as 0. The number of these stage 2 pressure ulcers that were present upon admission, discharge assessment is skip. The number of stage 3 pressure ulcers, we coded as 0 on admission. We're coding as 0 at discharge. The number of these stage 3 pressure ulcers that were present upon admission, the discharge code is skip. The number of stage 4 pressure ulcers, the discharge assessment code correctly is 0. The number of these stage 4 pressure ulcers that were present upon admission, the discharge code is skip. The number of unstageable pressure ulcers or injuries due to non-removable dressing device, discharge assessment is a 0. The number of these unstageable pressure ulcers, injuries due to non-removable dressing device that were present upon admission, correctly coded is a skip. The number of unstageable pressure ulcers due to slough or eschar at discharge is a 1. The number of these unstageable pressure ulcers due to slough or eschar that were present upon admission, correctly coded is 0. The number of unstageable pressure injuries with deep tissue injury, discharge code is 0. And item M300G2, the number of these unstageable pressure injuries with deep tissue injury that were present upon admission, correctly coded is a skip. And the rationale here is Mrs. S had an unstageable pressure ulcer due to slough and/or eschar on her right lateral malleolus. The pressure ulcer was identified as a DTI on admission. During her stay with you guys, it presented as a stage 4. However, at discharge, the pressure ulcer was completely covered by slough. We couldn't see anything, preventing visualization of the wound bed, so we really couldn't assess it. Therefore, it is considered not present upon admission. The stage 4 pressure ulcer that was on the coccyx has closed and would not be coded in the M300 at the discharge assessment. Okay, Planned Discharge Assessments, Section N, the medication section. Quick Slido question. Did the facility contact and complete the physician or physician designee prescribed recommendations by midnight of the next calendar day each time potentially clinically significant medication issues were identified since the admission? If you think the correct code is no, 0, you're going to select A, B is 1, yes, and C is 9, not applicable. Give it a minute. People are overwhelmingly selecting 1, yes. So let's see if you're all correct, and you are. And the rationale is the clinically significant medication issue identified by the pharmacist on the day of admission was communicated to the physician, and the physician's recommendations and actions were completed by midnight of the next calendar day. On day 10, she also had another episode, right? You read about that in her case study, a medication issue related to hydrocodone. A physician was immediately contacted, and the physician's recommendations of switching the medication, administering naloxone, and discontinuing the hydrocodone were completed by midnight of the next calendar day, and then there were no other significant medication issues. Okay, so now we'll talk just very briefly about the quality measure application. So we want to identify whether Mrs. S meets the inclusion criteria for changes in the skin integrity post-acute care pressure ulcer injury quality measure. Remember, Ann went over this with us and explained the numerator and the denominator. So let's see if this particular patient, her scenario, would be included. Does she meet the numerator requirement, which means her stay was included in the denominator, in which the discharge assessment indicates 1 or more new or worsening stage 2 to 4 pressure ulcers or unstageable pressure ulcers compared to admission? So do we believe she meets the requirements of the numerator? I'm hearing a yes. And that yes was correct. Somebody over here. So that's correct. How about the denominator? Patient stays with both an admission and discharge assessment, planned or unplanned, except for those that meet any exclusion criteria. So we know we did an admission and a discharge on her, so I'm feeling pretty good about that. How about you guys? And the answer is yes. Yeah. So she would be included. So this is a great slide to take back because sometimes that numerator-denominator thing can be a little confusing. So the numerator says that Mrs. S's stay would be included because she had the 1 worsened pressure ulcer, the unstageable pressure ulcer due to slough and/or eschar on her right lateral malleolus would be coded on the discharge assessment as not present on admission and would be considered worsened. She meets the denominator requirements because she had both an admission and discharge assessment. Okay, how about for the section and the drug regimen review? Let's see if she meets the quality measure requirements for that. Will she be included in your information? So in order for her to be included, she needs to meet the numerator, and that means that her stay had either 1, no potentially or actual clinical significant medication issues were found during the review, or she did have some significant medication issues that were found during the review, and a physician was contacted and prescribed recommended actions, and they were completed by midnight of the next calendar day, or the patient was not taking any medication. So who thinks she should be included? Yeah, I'm seeing hands and people are nodding at me. I appreciate that. And that's correct, you're right. She would be included. And for the denominator, patient stays during the reporting period. That's an easy one, right? She she was in our facility and we're during one of the reporting periods, so yes, she meets criteria. And again, the rationale is that she meets the numerator because the pharmacist conducted a drug regimen review for Mrs. S upon admission, and each time a clinically significant medication issue was identified, the physician was contacted and recommended actions were completed by midnight of the next calendar day. She meets the denominator because all patient stays during the reported period are included, and this measure has no denominator exclusions, and Carol told us that when she reviewed Section N. So a summary is, we have to have the achieved numerator and denominator for the new measures, the changes in skin integrity, post-acute care pressure ulcers, and the drug regimen review conducted for follow-up identified issues. And that's that. So I hope you'll take this case study back. I personally am going to do that at our facility as well. I haven't decided whether I'm going to do like a lunch and learn and have different people bring their lunch and go over it, break up into smaller groups maybe. For those folks who code the GG section, maybe different people code the medication section than maybe doing GG. It really depends on how you guys function back at your facilities and how you do your training. But I thank you. If you have questions, I think we're going to ask you to put them into your Slido, and then we're going to review them at the end of the day. I believe, I'm looking around, I believe it's lunch, correct? Yes, and we're due back at what time? We got somebody who's going to tell us all that. Good. Well, I thank you very much. I appreciate your attention and your kindness while I kind of muffled through some of the slides, but I appreciate it. Thank you.